I've also taught pediatrics and neonatology in a private medical college, a government medical college for around 6 years. So coming to the topic, today's topic is gastrointestinal problems in kids. So they are common cause for pediatric patients visit to OPD. Incidence of GI illness in kids is on the rise on account of increased consumption of junk food, stressful life, increase in screen time, decreased physical activity, with both parents working, decreased quality family time, and increased environmental exposure to harmful chemicals, genetic susceptibility to certain diseases like celiac disease, inflammatory bowel disease, autoimmune hepatitis, etc. In a study, it has been found that about 33% of kids visit a doc with pain abdomen by the time they complete 15 years of age. Most common GI ailments seen by a pediatrician in the OPD are abdominal pain, vomiting, diarrhea, constipation, and failure to gain weight. Now, coming to these topics one by one, first we'll talk about functional abdominal pain. Now, what is functional abdominal pain? It's a pain occurring for at least thrice a month for 3 consecutive months without any cause for it. We perform routine investigations, we perform ultrasound, all the tests are coming negative. And plus, there are no red flags. What are red flags? Red flags is when a child presenting with pain abdomen with decreased appetite, loss of weight, oral ulcers, painful swallowing, vomiting, persistent vomiting, and if the child is able to localize the pain in the abdomen, blood in stools, fever, joint pain, and any family history of chronic GI illness like inflammatory bowel disease, celiac disease, if the child has any of these, you must visit a doctor. So coming back to the functional abdominal pain, what is the treatment of functional abdominal pain? Now, if the symptoms are mild, we keep the child functional, be empathetic towards the pain, and we try to maintain his school, sports, sleep, and social life. If the symptoms are severe, we refer the child for cognitive behavior therapy, treat his anxiety. Now, second most common illness which we come across day-to-day practice is acute gastritis. What is gastritis? It's inflammation of the stomach wall. It presents as pain in the upper abdomen with vomiting. Older children may also complain of burning sensation or heartburn. The cause of acute gastritis, it's intake of spicy food, infections, be it viral, be it bacterial, inappropriate use of pain medicines, stress. Mostly the children will get gastritis while they are giving exams. Treatment is antacids, anti-ulcer, and drugs, light diet, and relaxation, mental relaxation. Here I would like to discuss some red flags for vomiting. Like if any vomiting is associated with bilious nature, if it is green in color, if there are blood in vomiting, if a child is having vomiting early morning, it might indicate some structural disease. You must visit your doc as soon as possible. Nighttime vomitings associated with failure to gain weight, vomitings associated with diarrhea, rectal bleeding, bleeding in the stools, abdominal distension. This might indicate that the child is having some serious issue and you must visit your doctor immediately. The next problem that I would like to discuss is constipation. What is constipation? Constipation is presence of hard stool, painful stool, which is difficult to pass. It affects around 30% of children, and more than 95% of children suffering from constipation, they have functional constipation for which no cause can be identified. It is common in the preschoolers, and it should be assessed for, this should also be assessed for red flags. Like if it is present since infancy or since birth, there is narrow diameter of the stools, failure to gain weight, height, and abdominal distension. Any of the above red flags will again tell you to please consult your respective pediatric gastroenterologist or your respective pediatrician immediately. For functional constipation, for which there is no cause, Dietary modification, increase in fiber, adequate hydration will relieve the symptoms. If the constipation is of longer duration, your child will require laxative, that too for a long period of time. At least 12 to 24 months of laxative use is required, and toilet training, adequate toilet training for the kid is required to get rid of the constipation symptoms. Now, we'll discuss about acute gastroenteritis or diarrhea. Mostly, diarrhea are infectious in nature. They can be caused by a virus or bacteria. They are associated with pain, abdomen, and vomiting. Red flags for diarrhea, we must rule out fever. If the child is very lethargic, not eating at all, if he has vomited for more than 3 times, if there is pus or blood in stools, not feeding, not maintaining the blood pressure, the child is feeling weak pulses, and if the child is malnourished, this requires immediate attention to doctor. You must take your child to doctor. Now, diarrhea of more than 2 weeks duration is known as persistent diarrhea, and this also requires immediate doctor attention. Other causes of diarrhea of longer duration are lactose intolerance, in which ingestion of dairy products causes flatulence, abdominal bloating, pain, abdomen, and loose stools. This can also indicate that the child, one of the causes that everybody is not aware of, milk protein intolerance, which might also present with chronic diarrhea. The child may be passing blood in stools. The child may be having anemia. This is due to the protein component of milk, which causes irritation of the colon and causes chronic blood loss from the GIT. The child may also present with chronic constipation and anemia. Finally, in our OPD, we come across children which present with failure to gain weight. So if we have children who are not gaining weight, we look for causes in the GIT, like malabsorptive diseases, like celiac disease. Celiac disease is a disease where children have sensitivity towards gluten, and the intestines are sensitive to gluten, which is found in wheat, barley, and rye. So the child is growth retarded, has anemia, can either present with constipation or present with diarrhea, or can only present with failure to gain weight. So appropriate tests are done. Other causes for not gaining weight are also ruled out. We perform a thyroid function test for the child. We also perform other organ function tests to rule out other systemic disorders accordingly. So these were the common GI illnesses which our children which we come across in a pediatric OPD. So any questions from the audience, I would like to answer. So this is a 6-year-old who keeps on binging chips even during mealtime and then complains about stomach problems. And how do you manage this? So this child is binging on chips. So there are 2 things to it. So binging on chips may lead to gastritis because they are spicy, oily, leads to stomach irritation. And the other thing is that our stomach has limited capacity to accommodate food. So when we overwhelm the capacity to feed, the stomach will start to pain. So for this child, I would advise the mother first that please give her nutrition dense diet, protein rich diet, like paneer, dal, pulses, eggs. You must try to incorporate protein in all the major meals of this child. Have a meal plan, regular meal plan, which covers the whole day. Make sure that the child is getting proper nutrition throughout the day, and give a positive role modeling to the child. You must not consume chips. Then a negative feedback in form of whenever the child is having pain abdomen, you must tell the child that you have had chips which are causing you pain abdomen. The child will learn this through this feedback that while having chips, I get pain in abdomen. I must not have chips. So 9-year-old is suffering from stomach ulcer. Home care should I take? First of all, stomach ulcer, you must complete your treatment with the doctor. There is a 2-week regime for stomach ulcers. You must take your antibiotics, your proton pump inhibitors, and then you should take care of your diet. The child should be given home cooked food without spices, and rich fiber rich food should be given to the child. And child should be encouraged to take meals only at home. No outside food is allowed. You should avoid oily food. And while preparing food, hygiene must be maintained so that the infection is not occurring time and again. 8-year-old is suffering from acidity after meals. Tried home remedies not working for her. What should I do? So we must look for the cause for the acidity. What is the base cause for the acidity in this child? Like if the child is obese, whether the child is obese, whether she's overeating, the type of food she's taking, the time of she's undergoing, whether she's in stress. So all these factors affect. I would just suggest a mother to please consult a pediatrician and rule out the causes. If your child is obese, then you must plan meals accordingly. You must avoid fatty food, fatty, salty, and oily food. You must avoid tea, beverages, chocolates, and pickles in this child. You must give small volume of feeds over multiple number of times throughout the day. The meals should not contain any kind of spices. This will definitely help her. You must take care that the child sleeps properly, relaxes properly. 4-year-old keeps on complaining about stomach pain every third day and his appetite has reduced too. What can I do? Now, this is what the red flag I had discussed while talking about abdominal pain. Now, this is a red flag. Any child which is complaining of stomach pain every third day with reduced appetite, this could indicate some underlying structural illness, some medical illness, which must be ruled out. You must see your doc as soon as possible. Your doctor will prescribe you some tests and will start you on medication according to the test. How can I prevent gastro problem in kids and strengthen their gut? Last question. Okay. Now, my father is a geographer and he says that a man is a product of his environment. So to have a healthy body, we must have a healthy mind and a healthy gut. So whatever we take in is whatever we have. Like we must have positive thoughts and we must have healthy eating habits. Positive thoughts in the form that, like, we are parents to our kids, we must have a friendly relationship to our kids. We should teach them about healthy habits, about hand hygiene first of all, about healthy food diets, habits like eating. Every time you eat, you must eat home cooked meals and avoid junk meals, and take proper amount of vegetables, fruits, carbs, and proteins. Relax. You must give your child some part of the day. You must all have a family time. You must relax in that time, and exercise is an important component to have a healthy body and a healthy gut and a healthy mind. So overall takeaway message to moms is that make sure that your child eats properly, eats home cooked meals, your child is stress free, and your child takes adequate amount of rest. which will prevent more than 95% of his gastro GI illnesses. This is the take home message.